This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Cabo Jim Schaller.
Welcome to episode number 210 of the Good Neighbor Podcast. Today we have good neighbor Don Hunt from On-Spot Dermatology. Welcome.
Thank you. Thanks for having me on today. I really appreciate it.
Yeah, excited to learn a little bit more about what you do in the community here and share it with our listeners. So let's jump right in. And why don't you start off by sharing a little bit about On-Spot?
Yeah. So again, my name's Don Hunt. I'm the CEO of On-Spot Dermatology. We are a mobile dermatology practice. So we have 8 mobile clinics that travel to different companies and communities around Florida to make it super convenient for individuals to get access to a dermatology practice. We have 2 mobile clinics that service communities in the Fort Myers, Bonita Springs, and Naples area. We've been servicing those communities for just about 4 years now. We're a practice that was born out of COVID. We saw so many people that were skipping out on their annual skin cancer exams because they didn't want to expose themselves to a doctor's office and just the problems that would come out of that. We also saw that so many people would skip out on getting an annual exam because with skin cancer, you might have a spot on your arm and it's not in pain. It's easy to push off and it's a tough appointment to get. Getting a dermatology appointment sometimes can take 3-4 months. So we saw an opportunity to build a quality practice, bringing it directly to the patient and allowing them to get a very important skin cancer exam. To date, over the last 4 years, we have found 9,500 skin cancers, 588 melanomas, and quite literally are saving lives in Florida as well as Southwest Florida.
Wow. I love that. So let's back up your story a little bit. How does somebody like yourself get involved in this whole industry?
Yeah. So I had a close friend who is a dermatologist, and he really shed light on this problem of so many people not seeing a dermatology practice on an annual basis. And when COVID hit and the whole world stopped, I really got close with this dermatologist and talked about this business idea of bringing dermatology directly to the patient. It really hit home for me, and I thought it was a brilliant idea. I didn't have a background in healthcare and dermatology. My background was really, I loved sales. I love building relationships with people. And I said, hey, why don't I help reach out to the communities and companies that may be interested in this? And then the dermatologist, you run the clinical side and the quality practice on that front. It hit home for me because I have a close friend whose father was affected by melanoma. He was 45 years old. He had a spot on the back of his leg that he kept pushing off because he had a full-time job. He was, going to baseball games, football games for his son, and just too busy to get that 15-minute appointment. And finally, when he did get it checked, it was very serious. And thankfully, he's okay today, but he's still fighting his melanoma diagnosis even after 20 years.
Wow. That's thank God for people like yourself and doing that as well.
Yeah.
So let's talk about challenges, starting a business, from scratch, not knowing a lot about the industry. There's got to be a lot of challenges. There's something that you can look back at now and you say, not necessarily glad I went through it, but I'm in a better place now because I did go through it.
Yeah, great question. One of the most difficult conversations I ever had when On-Spot was started is I actually reached out to this other dermatologist that is based in Florida and asked them their advice and if they thought this was a good idea. And they actually tore the idea up, said this is not going to work. People would never get screened inside of a truck. This is just, there's no business here. And, thankfully what we did, and I think, what a lot of great businesses do is they listen to their audience and listen to their customers, or in our case, patients. And we kept hearing from patients that said that they wanted services brought to them, whether it's a healthcare service or something else. And they talked about how difficult it was to get a dermatology appointment. And, we heard a lot of people that said this wasn't a good idea, not just from that one dermatologist, but from other investors, from people that were going to help with investing into the business, but we kept listening to our audience, and they said, this is a problem and we'd be very interested in it. And, we look back and that's one of the biggest lessons that we have. Listen to your customers, listen to your patients, and you'll build a great business.
Absolutely. And like you mentioned, when so many people say, no, that's not a good day, you probably have a good idea.
Absolutely.
They just,
Yep.
they just, sorry, they didn't think of it first. That's all.
Yeah. Yep. Absolutely.
So are there any maybe myths or misconceptions surrounding what you do that we can kind of clear up for our listeners today?
Yeah. So I think one of the most common misconceptions that we get is we're not a real dermatology practice, or we're not full service and we just do skin checks. So we always say we're a full service dermatology practice. We do everything from a screening to biopsies to even surgical procedures on our units. When we were purchasing our units, we really wanted to purchase high-end mobile clinics that made the patient feel comfortable and allowed us to do everything from not just detecting skin cancer, but also treating the patient as well. We wanted to give that full experience. So we are a full service practice. We can do anything that a typical dermatology practice does. And on top of that, we are a real dermatology practice. We don't, work with another practice or, are going to send you elsewhere. We can service you fully. And we also have a brick and mortar practice in Fort Myers at Gulf Coast Medical Center that allows us to send patients for follow-up appointments if we're not back in their community in time and they need to see us.
That's great. That's great. So speaking about Southwest Florida, are you from this area originally?
I'm not. I'm actually from Boston. And one of the reason why On-Spot was started in Southwest Florida is my grandparents live in a community in Bonita Springs, Worthington Country Club. And I would always visit. And when we started talking about this idea, we always envisioned going to communities like Worthington Country Club. And from there, that was one of the first locations that we booked with. And, we really started just because we knew the area from, my grandparents and visiting the area. So
that is great. Great to have you down here as well, too. So I
Yeah.
know owning a business can be very demanding of your resources and time, but when you do get a moment, what do you enjoy doing outside of work?
What I love about Florida is I love to golf. So I try to golf as much as I can. That's my favorite thing to do. And being from Boston, I could only do that 4 or 5 months of the year. So that's what I love about Florida is I can play all year round, and I try to go and play during the weekends as much as I can to, have a good time outside of work.
Absolutely. It's wonderful being outside, and golf is a game you got to play on a regular basis to
Yeah,
maintain and grow. It's tough. It's a love-hate kind of thing.
it absolutely is. Mm-hmm.
So is there one thing you wish our listeners knew about On-Spot that maybe they wouldn't be too familiar with?
Hey, I think one thing a lot of people say is just, which I understand, is, hey, I don't know if I would get healthcare services in a truck. And so what we always try to explain about our services and about our company is our mobile clinic is state of the art. We have over 4,000 5-star Google reviews. We use Google to really evaluate our patient satisfaction and what our patients are saying about us and how we can learn and make our practice better. And what we always say is, hey, look at those reviews, look at what residents of Florida are saying about us. And I think everyone would be surprised when they go in our clinic and see and feel like it's not a truck. It's like any typical doctor's office. And we're as professional, clean, organized as any practice out there. So, and we do a lot of good, and I'd encourage everyone to give us a shot. And if you're not going to give On-Spot a shot, that's okay. Just make sure you get your annual skin cancer exam.
That's the most important takeaway today. So
Absolutely.
how would our listeners go about getting in contact with you if they had questions, concerns, or would like a screening?
Yeah, absolutely. So you can visit our website, www.onspotdermatology.com. We actually have a book an appointment page where you can see the different communities and locations that we visit. We go to over 100 locations in Southwest Florida. So you can see if we go to your community. If we don't go to your community, you can reach out as well. And we're always open to new locations for us to visit. And sometimes residents are our biggest supporters for the community on getting us dates to come on site.
Love it. Love it. So any last words for our listeners?
No, just, hey, thank you so much for the time. I really appreciate it. We love the On-Spot story and think what we do is pretty special, and we love sharing it. And thank you for your time and listening to our story.
Absolutely. Don, it's been a pleasure getting to know you. Thank you for being such a good neighbor, and keep doing what you're doing.
Yeah, thank you so much. Appreciate it.
Thank you for listening to the Good Neighbor Podcast Estero. To nominate your favorite local businesses to be featured on the show, go to gnpestero.com. That's gnpestero.com. Or call 239-296-2621.